Coronaviruses are a wide family of viruses that can cause a variety of conditions, from common colds to more serious illnesses. As an example of the last one, we have the coronavirus in the Middle East that causes a respiratory syndrome. As you can see, there are more than just one coronavirus in the world. Knowing that, now we can talk about the COVID-19. COVID-19, also known as coronavirus disease and incorrectly as coronavirus pneumonia, is an infectious disease caused by the SARS-CoV-2 virus. It produces a lot of symptoms like fever, dry cough, myalgia, and fatigue. In severe cases, it can produce pneumonia, acquired respiratory distress syndrome, sepsis, and septic shock that leads to about 3.75% of those infected to death according to the WHO.
When did COVID-19 arrive in Panama and in our province? The Health Ministry passed to containment and mitigation phase under strict security protocols in our country this past March. The first case in Panama was a Panamanian woman, 40 years old, who entered the country on March 8, 2020 on the flight 6339 from Iberia, Barajas, Spain, who was made all the protocols establishes. After the time passed, the arrival of coronavirus in each province of the country was imminent. But Los Santos province was one of the last to report a case. The first case appeared approximately 3 months ago in Los Santos district, in Sabana Grande to be more specific. It was an adult woman from the capital of the country who caused concern in population because it was not announced before. Regardless, Los Santos is the province that records the least amount of confirmed cases due to the good management and behavior of our society. Next, here we can see a table that shows us a statistic of the coronavirus cases in Azuero. As we can see, our province has the lowest number of confirmed coronavirus cases. Los Santos has 78 accumulated cases, in which 3 of them are new confirmed cases. There are 48 recovered people of coronavirus. 29 cases are active. One of the cases is hospitalized, and unfortunately there is a deceased. Now we can see that Herrera has the highest number of confirmed coronavirus cases. It has 202 accumulated cases, in which 5 of those cases are new. There are 91 recovered people, 106 cases are active, and 5 deceased. This statistic was made according to information collected on Wednesday, July 22, 2020.
How is COVID-19 spread? A person can get COVID-19 from contact with someone infected with the virus. The disease is spread mainly from person to person through droplets that come out of an infected person's nose or mouth by coughing, sneezing, or talking. This drop can fall on objects and surface around the person, such as table, knobs, and railings, so other people can become infected if they touch those objects or surface and then touch their eyes, nose, or mouth.
In December 2019, a new disease was identified in China. In the investigation, the disease was caused by a new virus from coronavirus family, and inside began often named COVID-19. A COVID-19 is believed that have originated from a least meat and animal market in Huan City in Hubei province in the countries of China. It's later spread to other countries and was officially declared a pandemic by World Health Organization on March 11, 2020. What is scientific begins down to have a control over the COVID-19. Since the pandemic began, several groups of science of different parts of the world has begun investigating the behavior of COVID-19 and therefore can understand what would be the best strategy to combat it. Different vaccines are currently being tested in different countries like China, USA, UK, Germany, Brazil, and some in Panama. Thanks to science, doctors, epidemiologists, and researchers who will their effects seek to create a vaccine to treat a COVID-19.
The most common symptoms are COVID-19, tiredness, dry cough, and fever. Other less common symptoms: headache, ache and pain, loss of sense, smell and taste, diarrhea, breathing difficult. In case of the slightly symptom, the people infected with the virus must keep home isolation and wear the mask. In serious case, the people infected call 2169 to be referred the hospital or hospital. Then the people infected realize 2 tests of carry out to find out the people already overcome the virus.
Protecting your children, parent, grandparent, friend, and other family member should be a priority for everyone. Now, how can we do that? Practicing hand washing. Maintain cleaning and using alcohol gel when you are away from home is important at all times and the best way to protect yourself and others. When you are at a public place, keep a list and meter between you and others. This is especially important if you are next to someone who are coughing and sneezing, because some infected people may still have symptoms. You may maintain a physical distance from everyone if you are in an area where COVID-19 virus circulates.
To control the pandemic, the Ministry of Health began to work very hard since the first case was confirmed. Groups of specialists were organized to locate the victims' reports. The doctors carry out isopathy. The Ministry of Health announcing national quarantine, ordered to close the airport and the border to avoid a spread of the virus. If they implemented 2 virtual platforms to give orientation to patients via telephone calls, roads, and the Ministry of Health has had disadvantages. For example, lack of input, lack of medical staff. Also, that population does not follow the rules.
What is to isolate? To isolate, it refers to leaving something alone and separate from other things. Remove a person from communication and dealing with others. Abstract the immediate ability of the mind or sensing, or prevent the passage or transmission from other things, for example, virus, sounds, heat, among others. For example, isolation of people in serious lung condition is essential to preserve the health of the neighborhoods.
As the coronavirus continues to make headlines around the world, you're probably seeing a lot of measures you're supposed to take if exposed. Phrases like quarantine, isolation, and social distancing sound similar, but there are key differences and criteria for each. Let's break down these key terms one by one. First, quarantine, or the restriction of movement of people who seem healthy but may have been exposed to COVID-19. Varying degrees of quarantine exist, but all refer to individuals who aren't showing symptoms.
So quarantine applies to healthy people. When we talk about quarantine, typically what that means is that people are either put in a special location or they're just told stay home.
If you've traveled to any of the countries with a level 3 advisory from the Centers for Disease Control, this applies to you. The CDC says to stay home for 14 days upon returning to the US from China, Iran, Italy, or South Korea. This list of countries could grow. Next up, isolation, or the act of keeping those who are sick or infected away from those who aren't. Though on face value, quarantine and isolation may seem interchangeable, they aren't.
We make a distinction between isolation and quarantine. So isolation is when people who are known to have a virus are kept away from other people. As soon as someone who's under quarantine gets sick, it becomes isolation. So we want to use those words precisely. And isolation would be in a hospital because someone is sick.
Hospitals have taken strict measures to isolate coronavirus patients. They use ventilators that prevent air from circulating more widely, and health workers wear heavy protective gear. And finally, there's social distancing, which refers to keeping others at a literal distance to minimize risk. This can involve avoiding densely populated settings, like shopping malls, stadiums, and movie theaters. It can also encompass school closures, canceling large events, or teleworking instead of going to an office every day. To be exact, the CDC recommends keeping a distance of 6 feet from others if you've traveled to a highly infected area.
What should I do if I have been in close contact with someone what has COVID-19? People who have had close contact with confirmed case of COVID-19 should be kept in home isolation for no reason. They can leave their home for 40 days to be able to assess if they begin to present symptoms, fever of 38 degrees or more, also cough, sore throat, or trouble breathing. In this circumstance, it is essential to follow this instruction for health professionals regarding stay at home. Close contact means that these people have been for a long period 2 meters or less of a confirmed case of COVID-19 while he had symptoms. For example, they took care of that person, live with him, visit him, or share a small space.
plastic ban. Pull the top band over your heads and place it against the top on your head. Put the bottom band over your head and place it against the back of the neck. Place the bottom of the mask over your mouth and chin. Make sure the mask fits snugly. Do not touch the mask once you have put it on. If the mask becomes dirty or wet, remove it and put it on a new one. Washing your hands is one of the best ways to protect yourself and your family from getting sick. Hands should be washed after being in a public place and touching in an eating or surface that other people might touch frequently, such as door handles, table, shopping carts, electronic cash registers, before touching your eyes, nose, or mouth. The correct way to wash your hands would be wet your hands with clean water, rub your hands with soap until it foams, rub the foams on the back of your hands between your fingers and under your knives. Rub your hands together for at least 20 seconds. Rinse your hands well with clean water. Dry them with a clean towel. Droplet, a small drop of liquid, surface the outside part or layer of something.
When someone breathes out. Second, if any droplets do leave the person's mask, they are blocked from entering the nose or mouth of other people by the masks they are wearing. The key to all of this working is to wear masks properly. Let's review how to do this. Make sure your mask is tight against your cheeks, tucked under the bottom of your chin, and pinched tightly where it meets your nose. The goal is to make sure there is full contact between the top, bottom, and sides of the mask with your face. No gaps.
Avoid touching your eyes, nose, or mouth.
Keep social distance.
Do not visit sick relatives, especially if they are older.
Change your way of breathing.
If you feel any discomfort or you have a cold, it is recommended that you stay home. Do not go out.
You have to be careful when you're gonna sneeze or cough. When it happens, you have to put your arm in front of your face and put it on your mouth. In this way, the largest drops of saliva are gonna stay in this part of your arm and you're gonna be taking care of the person that you love.
Recommendation. We must follow the different recommendations given by the WHO, as they are based on science study. Also, get information through official sources and now follow the advice of unknown sources.
Home isolation. If the people infected with the virus must keep at home for during 14 days and then 2 tests carry out the virus. Mask. Object that cover the nose and mouth to prevent the spread of the virus or bacteria.
Sneezing can be caused by allergy or a cold. Cover your mouth and avoid infection.
Isolation. The condition of being alone, especially when this makes you feel unhappy. Assess. To judge or decide the amount, value, quality, or importance of something.
Mitigation. It is the action of reducing the severity, seriousness, or painfulness of something. Record. To set down in writing or some other form for later reference, especially official.
Hisopado. It is a test that analyzes a sample of secretion from the upper throat to detect organisms that can cause disease. Quarantine. The people are being kept separate from the other people for a set period
of time, usually because they have a disease.